Guys, in this video we want to teach OsteoClastoma, giant cell tumor. This has been asked in the exam, so you will have to know it. Kindly note that this is a benign condition. It's the only benign condition which they seem to be interested in for the exam. And it has uncertain histogenesis. That's why it is put as histologic derivation as unknown. So exactly from which part it comes, they don't know. So uncertain histogenesis, and hence it is classified separately. So there is giant cell tumor, and the malignant counterpart is called as the malignant giant cell tumor. Even Ewing sarcoma, they are putting it under unknown histologic derivation. Then you have something called as adamantinoma of long bones. Okay. So what are we reading now? Only OsteoClastoma. Okay. So what and all you saw till now, it has uncertain histogenesis. Okay. It is also called as giant cell tumor. The tumor arises from the epiphysis of long bones close to the articular cartilage. So from where they are arising? From the epiphysis of the long bones close to the articular cartilage. That's why you can see in this diagram they have shown you the epiphysis. Articular cartilage is here. Now most common sites are what and all? The femur, the tibia, the fibula and the radius. Okay. So what are the most common sites, guys? Femur, lower end, upper end of tibia, upper end of fibula, tibia, fibula, and then lower end of radius. So here they are saying lower end of femur. So it's more like knee joint, right? Knee joint. Lower end of, what happened? Lower end of femur. And upper end of tibia, upper end of fibula, and then you have the lower end of radius, that will be near the wrist, right? So just remember, knee joint means femur will be lower end, tibia and fibula upper end. Okay. So this is where mostly it occurs. The giant cell tumor occurs in patients between 20 to 40 years of age with no gender predilection. So we always use the word gender to distinguish male and female. As you can see here, they are saying that it affects patients between 20 to 40 years of age, and there is no discrimination on the gender. Moving on. Clinical features. What and all are going to be the clinical features? Weight bearing and movement. Okay. At these places there will be pain. So what will they present with? Pain. Okay, let's go back here. So, what and all are the clinical features? Clinical features are pain. Notice they present with pain, especially on weight bearing and movement. Okay, on weight bearing areas, movement. There will be swelling and pathological fracture also can be there. Hope the clinical features are clear. Radiologically, what you will see, that also we can write here. Radiological features, what you will see are giant cell tumor, large lobulated osteolytic lesion at the end of the long bone, obviously with characteristic soap bubble appearance. You will see soap bubble appearance where? End of long bone in the epiphysis, right? Here can you see the soap bubble appearance? Something like this. Cystic tumor, hemorrhagic and cystic tumor. Soap bubble appearance, right? So you can say large lobulated osteolytic lesion at end of long bone. That's nothing but the epiphysis. Correct? Shall we move on, guys? So let us just see, revise what and all we have seen in OsteoClastoma so far. Basically, it is benign. We saw this. And it has uncertain histogenesis. Hence, it is classified in unknown histologic origin. It arises in epiphysis close to the articular cartilage. It usually affects the knee joint, femur, lower end of femur, upper end of tibia and fibula. And it also can affect the lower end of the radius. Okay. Then we saw that it affects 20 to 40 years of age people. No gender discrimination here. No gender predilection. Okay. So let us put that here. 20 to 40 years of age. What will they present with? Pain, especially on the weight bearing, movement helping, those kind of structures. There can be swelling, pathologic fracture. Radiologically, you will see soap bubble appearance. This is OsteoClastoma, giant cell tumor of the bone. OsteoClastoma. Soap bubble appearance, large lobulated osteolytic lesion at the end of the long bone. Wake up guys if you are sleeping. Let me give you a wake up call. Hello. We are studying OsteoClastoma, giant cell tumor of bone. It's a benign condition. It happens in the epiphysis. You can see in the radiological examination, you can see soap bubble appearance. Okay. So here you can see giant cell tumor osteoclastoma. The end of the long bone is expanded in the region of epiphysis. Section surface shows circumscribed, dark tan, hemorrhagic and necrotic tumor. We'll come to the gross, don't worry. So we are done with a small introduction to osteoclastoma. Next we will read about the gross of the osteoclastoma. Then we will read the microscopy of osteoclastoma. Okay. Then we will read the other giant cell lesions, cells of origin. Then biologic behavior of giant cell tumors. That's all. So a lot of topics are there in the textbook. So meet in the next video for studying the morphology of osteoclastoma. This is microscopy. All the details we will look at in the next video. Okay. Take a break, enjoy, take rest and come back. Okay. Bye.